encephalopathy, vomiting, irritability, and lethargy. And then there's fatty liver abnormalities on the liver causing hepatomegaly, which is an enlarged liver. Etiology is greatly unknown, but they know that it develops after a mild viral illness and aspirin use. For diagnosis, there is no specific test. Abnormal accumulations of fat begin to develop in the liver and other organs of the body, along with severe increased pressure in the brain. Unless diagnosed and treated successfully, death is common, often within a few days or even a few hours. A person's life depends on early diagnosis. Statistics indicate an excellent chance of recovery if diagnosed and treated in earliest stages. The later the diagnosis and treatment, the more severely reduced are the chances for a successful recovery and survival. Things that could occur will be like some seizures and convulsions and loss of consciousness. Again, there's no specific test. It's just kind of a lot of different things that they do and rule out before they can find that this is what it is. A spinal tap can help identify or rule out other diseases such as meningitis. A liver biopsy is often going to be needed. And then a CT or MRI can be done to really get good images of what is going on. So stages, you're going to start with vomiting and lethargy, combativeness and confusion, coma and decorticate posturing, changing to decerebrate posturing, seizures, loss of deep tendon reflexes, and respiratory arrests. So fever is going to be found in profound impaired consciousness and hepatic liver function. 25% of cases are going to progress to coma and death with permanent neurologic impairments or even death. So here's a picture of that decerebrate and decorticate posturing. So in decerebrate, you're going to have elbows extended, wrist flexed, feet extended, and then decorticate posturing, you're going to have elbows flexed and wrists flexed as well, knees and legs and feet still extended. And that's just a sign that the messages to and from the spinal cord are being interrupted. Pediatric coma scales, there's a few different ones here that we look at. It's all kind of looking at eyes, speech, response to pain, that kind of thing. For treatment, they're going to be in the ICU for support and monitoring of physical status, monitoring intracranial pressure. They're going to be on a fluid restriction. IVs are going to need fluids, electrolytes, and glucose, frequent vital signs, and neurological assessment. We're going to be doing that Glasgow Coma Scale, monitoring labs for elevated ammonia levels, acidosis, or hypoglycemia. We're going to control cerebral edema with corticosteroids and may need mannitol, which is that osmotic diuretic to pull fluid off the brain specifically and control seizures, and may need meds to control any bleeding. Medications to prevent bleeding would include vitamin K, plasma, and platelets. If your child is having trouble breathing, he or she may need a ventilator. We're going to use caution when giving aspirin to any children or teenagers because of Reye syndrome. And so, and other medications that contain aspirin, Excedrin migraine contains aspirin, Pepto-Bismol. There's several over the counter, so we want to be sure and educate parents to not give their children that. And my mother-in-law, she always says, "Oh, let's just get you an aspirin, kiddo," and then I have to tell my kid, it's not really an aspirin. They just call it aspirin. It's not really an aspirin you're getting. So just to clarify. All right, sudden infant death syndrome. This is the second leading cause of infant death. It is unexpected death of previously healthy infant from ages 1 month to 1 year. It's also been nicknamed crib death. Clinical features, it's death that occurs during sleep. Infant does not cry or make sounds of distress during this, and peak incidence is between 2 and 4 months old. There have been lots of campaigns over the years. The first one was in 1992, which was the Back to Sleep campaign, which stressed putting babies on their back to sleep and not on their bellies. So post-mortem findings are showing pulmonary edema and hemorrhagic changes. So pretty much what's happening is accidental suffocation, that they're not able to move out of this position that they're in order to get oxygen. So risk factors, siblings of SIDS, and then preterm or low birth weight, sleeping in a prone position, prevention, supine position, putting them on their back to sleep every time, having a firm mattress that they can't like roll on top of and not be able to roll out of, and then do not overheat, having a fan going. Pacifier has actually been shown also to decrease the risk for SIDS. And then no blankets, getting rid of those crib bumpers, all those things. There's an increased risk in males, and then if they have a history of smoking, a maternal history of smoking, any recent illness in the family, decreased maternal age, so meaning a really young mother, poor prenatal care puts babies at risk, do not sleep with baby. Those are the primary things there. So tummy time is important with baby and development. So if they're going to do tummy time, make sure that it is supervised at all times and is when baby is asleep. When they go to sleep, they need to be placed on their back, removing all those little things and stuffed animals, everything, firm mattress, having a pacifier. There shouldn't be more than a soda can's width between bars in the crib. Avoid overheating, create a smoke-free zone, and then separate sleeping place from parents' room. And then here's like a sleep sack, so using things like this instead of a blanket to keep baby warm at night. Failure to thrive. We talked about this with those growth charts. So we start looking at trends that aren't following. If we're starting to plot a path and it's going here instead of along where it was, then we get concerned that we have failure to thrive. This is a deceleration from established growth pattern or consistently below the 5th percentile for height and weight on standard growth charts, sometimes accompanied by developmental delays. So this is weight loss or failure to gain weight for unknown reasons. A child may be irritable or weak, may have vomiting, diarrhea, anorexia, or pica, may have malabsorption issues. Situation can be complex, so this is where they need to go in for further testing. We don't know the prognosis. That is it for this last recording.